I want to focus on 4 important muscles on the shoulder. So right now you're looking at the deep muscles, and the 4 deep muscles I want to talk about are supraspinatus, infraspinatus, teres minor, and subscapularis. These 4 muscles together consist of the rotator cuff muscles. So they wrap their tendons around the head of the humerus, like the cuff on a shirt sleeve, and they stabilize the shoulder joint. Now, most of these muscles only wrap themselves on the humerus superiorly. Okay, so you can see there's little to no muscle holding the shoulder from the bottom over here. So this is the inferior view. But when you look at the top, there's enough stability provided through attachment of muscles on the top. Okay. The first muscle I want to focus on is the supraspinatus. Supra means above. Spinatus refers to the spine of the scapula. And the first muscle over here that I'm pointing to is supraspinatus. Supraspinatus is a very important muscle because this is a muscle which is most prone to damage due to excessive wear and tear in this region. So supraspinatus muscle originates on the supraspinous fossa. So supra means above, spinous is the spine, and fossa is the depression in this region. So supraspinous fossa is the origin of the supraspinatus muscle, and it passes underneath the acromion of the scapula and inserts itself on the greater tuberosity right over here. So it's the medial region of the greater tuberosity, so the tip of the greater tuberosity, that's where it inserts itself into. Okay, so the main function of this muscle is to abduct the shoulder. Abduction means moving away from the midline. So this over here is the supraspinatus. There are other superficial muscles that assist shoulder abduction, but if you just isolate supraspinatus, the function of supraspinatus is to abduct the shoulder at the shoulder joint. And the nerve that innervates this muscle is called the suprascapular nerve. Supra means above, scapular refers to the scapula, and that's the nerve that innervates the supraspinatus muscle. The next muscle in here is infraspinatus. Infra means below. Spinatus refers to the spine. So infraspinatus muscle attaches to the infraspinous fossa. So this is where it originates, at the infraspinous fossa of the scapula. So it's located right below the spine, and it inserts into the greater tubercle. So if you rotate this, it inserts into the greater tubercle just below the insertion of the supraspinatus. So this over here is the supraspinatus. The one I'm pointing to is the infraspinatus. The function of the infraspinatus is lateral rotation of the arm. Lateral meaning towards the outside. So it helps in rotating the arm outward. Okay, so if you rotate this around, you can see this lateral rotation outward is due to the infraspinatus muscle on the back. Now there are other muscles that also help in rotating the shoulder, but if you just look at the isolated function of the infraspinatus, it causes lateral rotation of the arm. The nerve that innervates this muscle is the suprascapular nerve, just like the supraspinatus muscle. So both of them are innervated by the same nerve. Now this is again a better view. Now this is lateral rotation, meaning rotating the arm away from the body or towards the outside. That's lateral rotation. The third muscle of the rotator cuff is teres minor muscle. So this muscle highlighted in yellow is the teres minor muscle. Now you're looking at just the teres minor muscle isolated. It's a small muscle over here. That's what's called teres minor muscle. It originates on the lateral border of the scapula. So this over here is the lateral border of the scapula. Okay, and it inserts itself on the greater tubercle of the humerus, right? And you can tell if you look at the other muscles that were here. The supraspinatus inserts right over here, infraspinatus inserts right over here, and teres minor inserts right over here. All of them are located kind of superiorly to the humerus, and they stabilize the humerus mostly on the top and on the sides, that is laterally. The function of teres minor is to rotate the arm laterally. So what you're looking over here is lateral rotation. It also helps in extension of the arm at the shoulder. So what we're talking about is the isolated function of the teres minor, but you can see the other muscles that assist in similar functions. The first one is the infraspinatus right over here, and on top you see the deltoid muscle. The nerve that innervates the teres minor is called the axillary nerve. Axillary means the armpit area, right? So the axillary nerve innervates the teres minor muscle. The last muscle that forms the rotator cuff muscle is the subscapularis muscle. This muscle behind the rib cage but anteriorly on the scapula is the subscapularis muscle. The subscapularis muscle, if you look at it, yeah, it's hidden. It emerges on the subscapular fossa. So what you're looking at is the anterior view of the scapula, and it originates at the subscapular fossa, and it inserts itself anteriorly on the lesser tubercle of the humerus. Okay, the function of this muscle is to internally or medially rotate the forearm. Okay, so this is the anterior view. You see the sternum, the rib cage, and this in yellow is the subscapularis muscle. The subscapularis muscle functions in internal rotation. Internal rotation meaning rotating the arm medially. So when the arm moves towards the midline anteriorly, that would be called medial rotation. So the antagonist muscle with respect to subscapularis is the teres minor muscle and the infraspinatus muscle. Both of them help in rotating the arm laterally, whereas the subscapularis help in rotating the arm medially. Now the subscapularis muscle, you can see how it is located, and this is the largest and strongest muscle on the rotator cuff, so or the shoulder. So 50% of the load is carried by the subscapularis muscle alone. So the nerve that innervates this muscle is called the subscapular nerve. Just like the subscapular muscle, the nerve will be called the subscapular nerve. The rotator cuff muscle, the injury, one of the most common injury of the rotator cuff is the tear of the rotator cuff. And this is called rotator cuff injury. So you can see that due to wear and tear, the rotator cuff muscle can tear. And that is called rotator cuff syndrome. This is most commonly seen in baseball players, volleyball players, swimmers, any kind of jobs that people have where they stack things above their head. They are prone to wear and tear of the rotator cuff muscle. The muscle that is most commonly affected is the supraspinatus muscles on the back. Okay, so the thing I wanted to focus on over here is the narrow space. You see, this one is the supraspinatus muscle, and this over here is the acromion of the scapula. So if you take a look, there is a very narrow space in between the acromion and the supraspinatus muscle. And what can happen sometimes is due to overuse of the shoulder, or when you play sports like volleyball or lifting too much weights, racquetball, baseball, when we overuse our shoulders, sometimes this narrow space, okay, is the cause of pain when the supraspinatus tendon over here gets inflamed. Okay, so when this tendon gets inflamed, it further narrows the space between the muscle and the acromion, which causes the acromion to press or pinch again the bursa of the shoulders or the tendon. As a result, it can cause bursitis. Itis means inflammation. So either the bursa can get inflamed or the tendon can get inflamed and cause tendinitis. Okay, this eventually can lead to rotator cuff syndrome when the tendon tears. So the treatment consists of either strengthening the shoulders through exercise or massage therapy. In extreme cases, surgery may be recommended. So in a surgery, they can either remove the piece of tendon that has been severely injured and then reattach it with the sutures on the bone, or they may even trim the bone to give more space in between the muscle and the acromion. Okay, so keep in mind, impingement syndrome and rotator cuff syndrome are two different conditions. Impingement syndrome leads to bursitis and tendinitis. Again, that's mainly due to narrowing of the space in between the acromion and the muscle tendon. Okay, and the typical symptom of impingement syndrome is painful arc while the shoulder is being abducted. So when you're lifting your shoulder, it causes extreme pain. Okay, and rotator cuff syndrome, on the other hand, happens when the rotator cuff muscle tear due to excessive wear and tear.